All right. Thank you, everyone, for joining us this morning to review the PACE program. We have Josh and Veronica with the Grand Rapids PACE office, and they're going to be going over what is it, what does it do, how does it help people, and how we can utilize it to help more people as well. So please take it away.
Well, good morning. My name is Veronica Horsley Pettigrew. I'm the Outreach Marketing Supervisor here at Care Resources PACE. I'm sorry, it might be a little noisy. I couldn't get I don't have an office in this building, so we have a kind of like drop-in space. So I'm in the cafeteria, so it might get a little noisy, but we'll get through this. And anyway, this is an amazing program. PACE is a program of all-inclusive care for the elderly. The PACE concept has been around for over 50 years. It was started in San Francisco in the 70s by a group of immigrants who did not believe in putting their loved ones in a nursing home. So they started a day center with other services, and then it evolved in the 90s with Medicare, Medicaid. So the program, PACE stands for Program of All-Inclusive Care for the Elderly, 55 and older, capitated payment system. And we have a interdisciplinary team to promote healthy independence and keep our people living at home. Most of us would like to stay at home until the end of our days if we age well. And with supportive services, you can do that with Care Resources. So we are the payer and the provider, which is really awesome. Most appointments for the physician is like 15 minutes for them to see. Will you be able to get a copy? Yes, you can get a copy of the presentation. I apologize. So most people, when you go to the doctor, it's like 15 minutes to see the physician. The beauty of our program, our physicians only service our participants, and they can spend as much time as needed. So we take care of all hospitalization, specialty appointments, Part D medication, skilled care. There's no out-of-pocket expenses, no donut holes. It doesn't matter what the medication costs. We take care of all that. So we have our own clinic in both of our facilities. We have one here in Grand Rapids, Michigan, and one in Lowell, Michigan. Our Grand Rapids location can handle 425 participants, and the Lowell office building is 125. So we have our own each person gets their own social worker. We have transportation to and from the center and any specialty appointments that are needed. We have nutritional programs, which is really good for any supplements that is needed. We make sure that the participant gets that. Any medical specialty appointments, dialysis, cardiologists, we make sure that we schedule those appointments for our participants, and we make sure they get to those appointments. If their loved one is not able to take them, we schedule all of the appointments, and that way they don't have to concern themselves with those appointments. We have a day center to make sure we have like 2 snacks and a lunch for socialization, which is huge for health, and we know that. We have Horizon is a pharmacy we have on staff in our building. So we're able to make any med changes that very same day. Our participants can take their medications home with them, or they are delivered to our participants by a bus driver or one of our nurses, whoever's out making any changes, they can take care of the medication. Rehabilitation, the beauty of our rehabilitation, most prescriptions give you like 20 to 20, maybe 22 weeks of rehabilitation, if that much. And after that, you're kind of on your own. For our rehabilitation center, we can give rehabilitation as long as needed, which is really, really good. So when you are the provider and the payer, that kind of gives you a little bit more leeway to do what is necessary without a limit for the people that we serve. So who we serve all of Kent County, a few zip codes, 5 zip codes in Ottawa County, Berry, Ionia, Kent County, Aldove, and Allegan County. We have 14 PACE programs in Michigan, and we do not occupy the same zip code. Some of the PACE programs we might kind of knock up against their zip code, but not in their zip code. So this is I provided this information. It's called a nursing, when they said that people who are eligible for nursing home, but don't go to the nursing home. A lot of people are in the nursing home because they don't have supportive services. And we provide those services. So say a person, if you encounter a person who needs assistance getting up from a seated position, not by holding onto a chair or walker. They have to physically have someone helping them at least 3 times a week, getting up from a seated position, helping them get to bed at night, assistance, toileting. That would be considered like a door 1. A door 2, cognitive impairment doesn't necessarily mean they have to have a diagnosis of dementia or Alzheimer's. It could be any memory issues, and there's a test for that to determine that. So then we have a door here that's for people who have oxygen. Yes, there are people who work and use oxygen, but there are people who are on oxygen that are not getting supportive services in other ways. There is also a door that's not listed here. It's called like a door 8, a frailty door. So, and the reason I've mentioned this is because you might encounter a person that they have some issues, but you're not quite sure if they fit one of these doors. If they are having a difficult time, like getting dressed, like might take them 2 hours to get dressed. Eventually they will get dressed, but it might take 2 hours, which means they'll miss appointments. They won't be going out socializing. So those kind of things, kind of be open to that. But if you're in doubt, just let us do the assessment, and then we can determine that. But that's just a general guideline right there. So I put this here, this is like, how can we collaborate? And so if you're if a person's experiencing medical or personal care needs, such as they're not bathing, other experiences like forgetting their medication, of you're just not getting out, that's someone you might want to think about. Then we have the seniors that they go to the emergency room quite often. And this is a real thing for socialization. So they'll call and go to the emergency room. We've had participants in our program that they went from maybe being, they call them frequent flyers to the emergency room, to no longer doing that, because if they're coming to the center, or if we have an aide going in to do their laundry and helping them shower or do light cleaning and cooking, then they're getting the stimulation socially that they need, which is very helpful for health and for mental health and physical health. So frequently, caregivers expressing burnout, caregiving is not for the faint of heart. And most of us have all the intentions of the world taking care of our loved ones because we want the best for them. But it depends on where you are as a caregiver in a journey. You could be the sandwich generation, which means you're taking care of yourself, your husband, and your children, and now you're one of your parents, or maybe both of your parents. That's a lot. So this program could help with giving respite by having the person come to the day center. And we do have people in our program who live with their son, daughter, daughter-in-laws, and family. And we are able to go in and have them come to the day center. We're taking care of all their medical needs, all their appointments. And if you're working and you have children, that is huge help to a family. And we do have families in our program that's been in our program for years, that when the caregivers want to go on vacation, we take care of their loved ones while they're gone. We assume all responsibility once someone is in our program. So that, so there might be another is that minimal informal supports. There's the struggling to live at home. Sometimes they're just sitting and not cleaning themselves, not cleaning their apartment, just not doing anything. They're just struggling to live. And so if you have a program like this, which is all inclusive, and so you have a team of people taking care of a person, which is really great. And see, our team meets every day, Monday through Friday, and we're open Monday through Friday, 8 to 4:30. But the teams meet every morning and we know what's happening with all of our participants. So we can intervene at any time to take care of or make any corrections of medication or care plans. And they have a care plan for each participant, which is different, unique for each person. So everyone does not need the same level of service. It just depends on where the senior is in their aging journey. So seniors experiencing memory loss and confusion. And again, that does not mean that they have been given a diagnosis of dementia. Memory loss starts sooner than people even realize. And some people may never get a diagnosis of dementia or Alzheimer's. They just have memory and confusion, which means if you're not remembering to take your medication, it's very difficult to stay healthy and have a good quality of life. And so any senior was at risk for placement in a nursing home. Nursing homes are needed, but there are many, many people in a nursing home that they don't need to be there. But if they don't have the supportive services, and if they did, they could age at home. I don't care where you go in the world, in my mind, that there's no place like home. And that really is what the tagline is there's no place like home. And if you live, you're going to age, and aging is a different journey for everyone. But we want to make sure that any seniors will have the quality of life that they deserve. So I'm sorry, this needs to be updated. The beauty of this program is Medicare and Medicaid. And I have to say that probably 98% or so of our participants are what they call dual eligible, Medicare and Medicaid with zero out-of-pocket expenses. It doesn't matter what the medication costs. If the insulin is $1,000 a month, then we make sure that is taken care of, which is huge. I've done assessments where people have had medication that they have to pay $1,000 for their medication. I don't know about you, but paying $1,000 a month for the medication and you haven't even paid your rent, mortgage, food or other items, that's really quite costly. And I had this one person was rationing out their insulin, which is very dangerous. And then he started to go blind. So these kind of things is huge when it comes to medication management and not having to pay for any out-of-pocket expenses at all, no donut holes. We do have a private pay option. The person has Medicare and they pay private, we'll say $5,000 a month. It just depends on the zip code area. To qualify for Medicaid with PACE, now the new cost is $2,901, which is great. Gives more people the opportunity to qualify for Medicaid because typically I think in a community, you can't have over $1,100 or $1,300 per month, which is not a lot, but that will, if you have over that, you don't qualify for Medicaid. And so, a lot of services in the community you don't qualify for. So, but the income level is much higher. So that gives people the opportunity to be able to afford PACE. So the new and exciting thing about assets, it used to be 2,000 or less. Now it's 9,660, which is amazing. And the reason that it's amazing because we had people that own a home that would not come into the program because they would have to spend their assets down to 2,000 a month, which is kind of scary if you own a home because say your water heater went out, that could be $1,000, or you need to have a roof repaired. So increasing this asset limit is huge, and we were able to bring in a couple people from March that had a higher asset limit, so they didn't have to spend down their money, and which is to me, I've seen over the years people not being able to take advantage of this program because of that. That is very, very important. So with a couple, we do have, married couples, and then that's a whole different process. And so our intake coordinator can take care of that conversation once they call in. So the process starts, if you made a referral, maybe the 15th of the month, if they have Medicare, Medicaid, we could possibly get them in the program, by the 24th. I think the 24th by noon, and then they start the following month. So if you make a referral and now, today is what is it, the 27th? Then they wouldn't start until April 1st. So that's how the state has it set up. The new participants start the 1st of every month. So you call the intake coordinator, or you fax some information or email, and then they will make sure they get assessments by a social worker and a home care nurse to assess them and see where they are in the process. And then a care plan is created. There's no a care plan that is alike. Each participant has their own individual care plan because it depends on the level of care that is needed. So this process could take 15 days, 30 to 45 days and we have our own DHS worker, and we have a relationship with the whole center for getting Medicaid applications done quickly. And once the person is in our program, we do all the redeterminations. They don't ever have to worry about that again. We make sure we take care of all of that. So there's questions that's asked, and they said, one of the questions is people want to know if they have to give up their specialists and their physicians. In the past, we would say, you had to use our physicians and that's it. And so people did not come into the program. But it's interesting, we changed that and we said, okay, you can use your primary physician for 2 visits per year. Your physician has to agree to coordinate with our physicians because we assume our responsibility once a person comes into our program. So we have to make sure all the care is coordinated. I have to say, when we made that change a few years ago, we have not had one single person that stuck with their primary physician. But I think sometimes when you're a senior, you start to lose so many options, and your choices are limited because of maybe health concerns you might have. So we want to make sure that people have as much say over their lives as possible. So another question, let's see. Can I enroll in PACE in another program at the same time? We cannot, you cannot enroll in 2 state programs because we are the payer and the provider. So it says, is day center attendance required to enroll in care resources space? No, not at all. There was a time we did require that people, if they came into the program, to come into the day center. And we enforced that pretty strong because we wanted to make sure we kept an eye on a participant and make sure they were getting the socialization that they needed. But we changed that because the day center option is not for everyone. Sometimes people decide they don't want to come, and sometimes they change their minds. So that just depends on the person. But we will make sure we have eyes on you because we'll bring you in for assessments to see the physicians. And so the social worker is each person has a social worker that's an advocate. So we're able to make sure we understand what's happening with each and every one of our participants. And says, can I keep my current paid caregiver? It is very possible that could happen. We have hired some caregivers of people who have them. It just depends. We don't say yes across the board, but we would consider it. So do you have any questions?
And if I could jump in for just a second, Veronica, thank you so, so much again for your time this morning and for being so flexible. I really appreciate it.
My pleasure.
One thing I wanted to touch on here really quickly for the agents is in regards to when it comes to the referral process. So for individuals who are new to the PACE program, if you are an agent and you are referring them into the PACE program, It is the same compensation as if that individual was new to Medicare. So that program pays the same way as enrolling somebody new to Medicare. And then at the beginning of the 13th month of enrollment into the PACE program, you would begin seeing renewals as you would with any individual enrolled into a Medicare Advantage plan. So this is a huge tool for agents because not only is it ensuring that your clients who have a nursing home level of care and need these services the most are able to get those services, but as we're entering lock-in and with the change in SEPs for 2025, this is also a great opportunity for agents to be able to supplement some of the offset that you might see from not being able to enroll individuals into Medicare plans while still making sure that they are able to get the care that they need and take advantage of these great resources that the PACE program does offer to them.
Yes. I think that is really key because I think you're able to only enroll at certain times of the year, but this way, if you have a referral, then you're still,
Exactly.
yeah,
Yep.
this is really
With
huge. Yeah, with the
It's
contract.
great.
Yes.
Yeah, and that's one of the great things about the PACE program for those clients is, as we're entering lock-in, as Veronica said, individuals who have Medicare or Medicare and Medicaid are able to only make plan changes or enroll into plans at certain times of the year. But if they meet the qualifications for the PACE program and they need this care, they are able to do it at any time of the year. They don't need a special enrollment period or anything like that. They just have to meet the qualifications of the PACE program and they're able to take advantage of those benefits any time of the year. So that's a huge, huge benefit there with the PACE program.
So
And
the referral
yeah,
process,
go ahead. Thank you.
I'm sorry that you can call our intake team and the number is make sure I'll have that available, and it's Shannon Johnson. And then there's a referral form. I will make sure I email that form. And where are the other locations in the state? Can we get a list of?
Yeah, and I do have I have the referral form, so I can
Okay,
send that over to Miranda so she's able to get that distributed out. Are you also, I know Corey was just asking about the requirements. Can we, I'll send you an email afterwards just to get the updated numbers
sure.
for the monthly income and the assets so I can get
Yes.
that updated and get that over to Miranda as well.
Mm-hmm.
Perfect. And then, yeah, if you could touch base on the other locations in the state.
So, and I think, you know what, I think I have a file that I can send that, I'll send that to you. I have it, yes. All the
Perfect.
PACE programs, and it gives an idea to what the number of participants that they have right now. And also that you can call a certain number and they can see if there's a PACE program in the zip code that you're looking for. So I'll make sure I get all that information to you.
Perfect. And just to kind of touch base on that, to give a little bit more insight, from a referral standpoint, when it comes to agent compensation, the only ones that currently offer that program are this PACE program in Grand Rapids, and then the PACE program of Southeast Michigan, which is Wayne County, Oakland County, and a slight little bit of Macomb County. But there are other PACE programs throughout the state of Michigan that do still offer all of these great benefits to the individuals who qualify for them.
Right, exactly. Yes. And so, yeah. And you have to make sure that Shannon knows when you make the referral that you are from the insurance company, because that goes in a different way. So that makes sure that you get compensated. So we have to make that distinction. Is that helpful?
Very much so. Thank you.
Mm-hmm.
And the form that I will send over to Miranda, it is specific to verifying that they are from the insurance agency.
Okay. Okay, great. Okay. All right.
Perfect.
And I will make sure you get updated information. I apologize for that. We just,
No, that's okay.
Mhm.
That's a great problem to have, having that limits that much higher and the Medicaid limits that much higher. So that's
Yeah,
great information. I will absolutely touch base with you and get an updated copy to get that to Miranda.
okay.
Miranda, before we wrap up, do you have any questions or anything you'd like to add in?
I was just kind of curious, how is the PACE program funded? Is this state fund?
State and federal, yeah, state and
Okay.
federal, Medicare, Medicaid, state and federally funded.
Okay, fantastic.
Yes.
No, any other questions? Anyone feel free to unmute or throw it in the chat, but that was very thorough. It sounds like an absolutely beautiful program. I'm grateful it's available and we'll definitely encourage agents to utilize it.
And if you would like to come in for a tour, just let me know, or Shannon, so that seeing is believing. This place is, you know, I can tell you just how amazing. I've been doing this for 8 years and I have seen people's lives transform because they're getting the coordination of care and not forgetting. I mean, I don't know if you called, you know, to renew a prescription or get a prescription, it's really quite complicated for someone who has cognitive issues. And so, which means they don't get their medication. So when you have a program like this that's taking care of and filling all those gaps for a person in need, then you just have this amazing, healthier person and with a better quality of life.
Absolutely. Yeah. I love that. And I would love a tour myself too. So I'll reach out to you on that.
Okay, great. That would be great. Yes. Mhm.
All right. Well, I don't see any other questions popping in here, but that was wonderful. this is recorded. We'll share it out to all agents and we'll definitely reach out with any questions. Thank you so much, Veronica and Josh, for your time. I
Well,
appreciate it.
thank you very much. And I look forward to your email, Josh. Thank you.
Absolutely. Thank you, Miranda, and thank you, Veronica.
Enjoy the rest of your day.
You too. Bye-bye.
Bye.
Thank you.